My name is Taylor Gibson, and during this PowerPoint presentation, we're going to be covering vaccination protocol for market sheep. So whether your sheep is going to show, which is a 4-H or FFA program, and then going to market to be slaughtered, or if it's raised on a large scale or small scale breeding farm for market sheep, we need to vaccinate all of these diseases, and bacterial diseases and viral diseases in either scenario. So we need to vaccinate against clostridial diseases, foot rot, cautious lymphadenitis, bacterial pneumonia, and then the viral diseases will be sore mouth, blue tongue, and rabies. So the first vaccine is called Glandvax 6. It's from Zoetis. They produce a lot of vaccines. So this one is for clostridial and cautious lymphadenitis. They go ahead and vaccinates for both of those, which were two diseases that were previously listed. So this is easy because it is just one vaccine that covers two different bacterial strains. So Glandvax 6 is a killed vaccine, which means it's inactive, so it's consisting of inactive pathogens. It's not a live bacteria. It is killed, hence the name. Vaccinating against cheesy gland, cautious lymphadenitis, enterotoxemia, tetanus, Black's disease, malignant edema, blackleg, and swelled head. And we don't really normally have to worry about that last one. That's for rams. I just went ahead and put it in here because this is a pretty broad spectrum vaccination. So for market lambs, they should have been vaccinated between 6 to 8 weeks and boosted 3 to 4 weeks after the initial dose. If there is history is unknown of the vaccination, then we need to go ahead and vaccinate the market lamb at the time of purchase, and then go ahead and do a booster 2 to 4 weeks after the initial dose, because we want to make sure that they're vaccinated before exposure to any other sheep. The vaccine is administered subcutaneously as a 1 milliliter dose. The injection site should be on the side of the neck, just behind the base of the ears. And then the withdrawal time is 0 days for this vaccine, so we don't have to worry about the time we vaccinated to the time that we slaughter. It's not going to affect humans that way. So foot rot is another disease that needs to be vaccinated for. Footvax is what the vaccine is called. It is a killed vaccine, which means it's not an active live virus or bacteria, so it is dead, but it does have the particles to provide immunization. And this is used as a precautionary method for preventing foot rot. The market lamb should be vaccinated based on anticipated problems regarding climatic conditions and the likely chance of incident of foot rot, which it can change season to season. So this isn't I guess considered like a core vaccine. It's pretty much based on if you suspect that foot rot will be taking place. That's when you go ahead and vaccinate. And then you can revaccinate every 4 to 5 months in that type of interval if need be. But most of the time these market sheep will be getting slaughtered, so they're not going to be living years to be getting this intermittent revaccination. That was just kind of some extra information about the vaccine. And then this vaccine is administered subcutaneously as a 1 milliliter dose. The site of injection is again on the side of the neck, about 2 to 3 inches behind the ears. So at the base of the ears, you just go down a few inches, and then that's where you will vaccinate for this one and the previous one that were just mentioned. So the withdrawal time for this Footvax, is also 0 days. So we don't have to worry about the time we vaccinate to the time that we slaughter. The next vaccine covered is going to be bacterial pneumonia. And this vaccine, Menhaimia hemolytica pastorella multicida, is killed vaccine. So it's not a live vaccine, it is just particles of the bacteria that can provide immunization. And this does vaccinate and protect against pneumonia. The market lamb should have been vaccinated less than a month of age, and then it should have been boosted 2 to 4 weeks of the initial dose. The lamb can be revaccinated after weaning 4 to 6 months of age. So if you're unsure of the vaccination that occurred at a young age, from birth to when you purchase it, you can go ahead and safe to revaccinate around 4 to 6 months. Vaccine is administered subcutaneously, like the previous vaccines that were mentioned. A good spot to choose is 2 to 3 inches on the neck below or behind the base of the ears. And I don't know if I mentioned it, but it is 2 milliliter dose. With the withdrawal time is going to be 21 days for this one. So this is the first vaccine we've covered for sheep that requires a withdrawal time. So we don't want to slaughter if it's been not 21 days. That makes sense. So we want to wait 21 days, in other words, till we slaughter from the time we vaccinate. Sore mouth disease is the next vaccination we will cover. Bovine ecthyma is a live attenuated virus vaccine, which this is the first one we have covered in this PowerPoint presentation. That is a live vaccine. So this means that the vaccine has not been killed or deadened. It is live, but it's a weakened strand. So it's not obtaining the disease-causing capacity. So it's not going to cause the disease, but it still possesses the immunogenic properties to provide immunization to the animal. The market lamb should have been vaccinated at 4 weeks of age and then boosted 2 to 3 months after the initial vaccine. So range lambs entering a feedlot should be vaccinated 10 days previously. So we can go ahead and vaccinate when the lamb is very young, around 4 weeks of age, and boosted. And then when we're going to a feedlot, if it's in a large-scale farm type setting, then we need to go ahead and vaccinate again 10 days prior to moving them to the feedlot to ensure lamb is vaccinated prior to showing. So if it is a 4-H or FFA type situation, then the lamb does need to be vaccinated prior to showing, just as if it was going to a feedlot. So for this vaccine, we're going to select a wool-free area of skin, and we're going to scratch an area that's about a square inch with a notched handle applicator. So this applicator actually comes apart. You kind of see it in the picture on the bottom. It comes with the vaccine kit. So you'll sit there and you'll scratch, not to where the animal's skin bleeds at all, but you're just trying to make the skin rough. And then the vaccine can now be applied to the scarified area. That's what they call the area that you scratched of the skin, by dipping the brush into the vaccine bottle and then brushing it vigorously onto the skin. So the vaccine is actually going to be absorbed into that area of skin that you had scraped. And then the withdrawal time for this vaccine is also going to be 21 days, such as the previous. We don't want to slaughter if we have vaccinated within that 21-day period. We need to wait 21 days before we slaughter after vaccinating. So the blue tongue vaccination is the next one we're going to cover. It is a modified live virus vaccine, type 10. So there are different types of this vaccine. So I do suggest that you talk to your veterinarian with which type or strand that they suggest you do vaccinate with. But this specific one that I had researched is for type 10. And as I had mentioned earlier, it is a live virus, so it's just a weakened strand. It only provides the immunization needed. It's not going to cause the disease. So the market lamb should be vaccinated when they are over 3 months of age, and it doesn't need to be boosted. So the vaccine can be administered intramuscularly or subcutaneously. It's really just preference. Either way works equally. As a 2 milliliter dose, the axillary space between the foreleg and the body is a convenient site. So that's just what this website had recommended. It should be fine to choose any area that doesn't have wool, just an easy access to the skin to make sure you're getting the vaccine into the animal's body. And then the withdrawal time is going to be 21 days, such as the previous two. We don't want to slaughter if it hasn't been 21 days since the vaccine was administered. And I believe this is the last one, the rabies vaccination. This is a pretty common one that people know of because almost every animal receives the rabies vaccine. This one is called Defensor 3. It is a killed and inactivated vaccine which protects against the rabies virus. So it only possesses particles to provide immunization. It's not a weakened strand of the virus. So the market lamb should be vaccinated when they're over 3 months of age. And the vaccination should be administered intramuscularly as a 2 milliliter dose. And then similarly as the last one, the axillary space between the foreleg and the body is a convenient site, or we could do this in the neck, 2 to 3 inches behind the base of the ears. Again, just an area where there's not too much wool to make sure the vaccine enters the animal's body. And then this vaccine does not require a booster vaccine. And then the withdrawal time for this one is also going to be 21 days. So don't slaughter if it hasn't been 21 days because it won't be safe for human consumption. And then I went ahead and numbered my references 1 through 6. So you can go back and look at the information and the photographs and they'll be cited there corresponding to the number. Thank you.